SOS International's efforts locally and globally are producing life-saving results. Their most recent trip to Ghana reduced maternal mortality there by 24% in 9 months. According to SOS, 800 women die every day from childbirth. 95% in developing countries like Ghana due to lack of medical care.
It's so preventable.
Last year, SOS sent supplies and equipment, including the first infant warmer ever in rural parts of the country. The nonprofit also established a clinic that transformed into a hospital, reducing an access barrier and helping women and their babies live.
What we do in a moment lasts a lifetime.
Because of the nonprofit's work, no pregnant patients died last year in Ghana, a historic improvement, according to a member of parliament for North Tongue, Samuel Okuzeto Ablakwa.
The reality is that, look, so many people have been saved, and they don't even know how come they were saved. They don't know that it's people working here at SOS, people who are sorting the medical equipment, who are packing them, who are shipping them, who are saving their lives.
Ablakwa traveled to Louisville not only to thank SOS President and CEO Denise Sears, but he's making community connections to further meet the needs in his country, knowing health is fundamental for any success.
Once my people are healthy, my people are able to improve their quality of life, then we can move on to other issues about economic empowerment, about industrialization, about job creation.
SOS's collective humanity of caring for others is why the Honorable is grateful. But Sears says it's simply part of the mission that'll continue for generations to come.
Global health is often seen as the race is completed once you've provided the humanitarian help to advance health. I see that as the first phase of the race.
Alexis Matthews, WLKY News.